Thank you, Anu, for that. So, as a patient yourself, and you've been through a lot of procedures and met a lot of doctors and so on, how do you think that patients with CVDs can use their voice and use their experiences to advocate for better healthcare policies? And, so that we can reach more people. And not only that, but, you are in public health. How do you help with resources? How can you share this with others? So can you tell us a little bit about what you do in Nepal to raise awareness for this?
Yeah, thank you. Yes, currently I am involved with a Global Alliance for Rheumatic and Congenital Hearts, Global ARCH, which is the alliance of patient and family-led organizations that focuses on rheumatic and congenital heart disease. But our work is not just limited to that. We empower and engage patients or people living with condition, their care providers, and also involve in the supervision and in the collaboration with healthcare providers in many countries. So here, what I want to say is, living with this condition, our views, our perspectives are the incredible resource, the power that we possess, although we are just people living with NCDs or cardiovascular disease. But it is the important part. In our previous panel discussions also, we talked that, and we also, I think we all agree that even though there are policies or different discussions around health and other sectors, but it is the people who have to live with this condition, not just for one day or a week, but in every seconds until we take our last breath. And we cannot take a weekend off or a month or days off. But yes, and the work or the experiences that we as a patient have can be an inspiring source. Our experiences can encourage other people who are living with this condition, and also our lived experiences humanizes the data that we have in the works that researchers or the healthcare providers or other people do in terms of health conditions. And with this, we can advocate on our needs or during our trajectory to healthcare journey, and we can highlight that, okay, there is a gap in the services that you provide in healthcare settings, or there is a gap in the policies that are missing to focus on people, the real needs of people living with NCDs. So our experiences, our stories can help the policymakers and other who are involved in providing health cares to fill in the gaps.
Okay, great. I'm going to ask you this question. I mean, since you're here and we have a global audience, there are people who are listening in online as well. So my question is very simple. As a person who's had 24 years of experience in this, and you're talking to a number of people here, both patients, you're talking to agencies, you're talking to healthcare systems in different countries. What would be the maybe one or two things that you would want for healthcare to be able to do for you to help you on this journey? And while you think of that answer, I just want to tell you all that if you have any questions, please put up your hand. And even for the people who are online, I don't know who's looking at the questions, please share those questions with us so that we can have a properly inclusive conversation. So if you've got a question, please do put up your hand. Someone will pass you a mic. But I'm going to go to you, Anwar. Now that you've thought a little bit about it, what is that one or two things that you will ask healthcare organizations and systems to be able to do so that they can listen to patients a little bit more? What are those things?
So few things that I want to highlight here is the sole goal of every person who are living with this condition, or the healthcare providers or the government, is health. And health is health of not the country, but a health of a person. And when our sole goal is to improve health, why not we include people who are living with this condition in every discussions where health is discussed? And here I want to highlight that the healthcare providers or the agencies that works on health, they need to include those communities in co-creating, co-designing, and co-implementing, and also monitoring the policies or the actions that are made in the community for the community, and to check whether it's been really implemented or not, and whether it is making really positive impact, the positive health outcomes or not.
Okay.